Welcome to Let There Be Vision podcast. This is Dr.Sirish Nelivigi, Ophthalmologist and Eye Surgeon in Bangalore with you. As I discussed in my previous podcast episode of Let There Be Vision, we will discuss and try to create awareness about healthy vision. In today's podcast episode, I would like to provide some awareness on cataracts in children. Listen to it carefully. Clouding in your child's eyes? It may be cataract. A cataract is an eye condition in which your natural lens in the eye starts to become cloudy over time and affects your vision. As most of you would already know, cataract most commonly affects people as they age. Hence, it's more common in people who are above 40. It is extremely rare to see cataracts in children or young adults. However, they are not exempt. We do see cataracts in newborn babies. We do see cataracts in young children and early adulthood as well. When we see it in the babies, we call this as congenital cataract, which they are born with. And this cataract can either be eyesight threatening or can be so bare minimal that actually we can ignore them. As they age, in the young adulthood, children can have cataract. Again, this cataract, which is called as developmental cataract, can either be steady and stable without increasing or can be progressive. If it is a progressive cataract, we would definitely need to intervene in such situations. And if it is a stable cataract with minimal effect to the vision, then usually we don't need to do anything for that. The cataract can be either in one eye or can happen in both the eyes together. There can be other types of cataracts in addition to congenital cataract as well. The congenital cataract is the term which we use to describe the cataract that a baby is born with. The secondary cataract is the term which we use when the cataract develops over a period of time. This can be secondary to some specific cause, like say for example diabetes, trauma, or some toxic reactions or chemicals. Medicines are one of the common things which can cause secondary cataracts, especially medicines like steroids. Traumatic cataract is the other type of cataract. In traumatic cataract, there is usually an eye injury which can cause irreversible changes on the crystal clear lens, causing it to become opaque and hence develop cataract. Radiation type of cataract or the radiation cataract is one of the rare types of cataract which occurs when anybody's eyes are exposed to radiation for a prolonged period of time. Before I move on to the symptoms of cataract in children, let me again add up a few more things about congenital cataracts. The congenital cataracts can be formed due to numerous reasons. It may be inherited from the parent to the child. It can be passed from genetic conditions like Down syndrome. It can be caused due to some eye infections or infections picked up at the time of birth, or diabetes, or inflammation, drug reactions, or metabolic problems. Also, there are instances when the cataract is not diagnosed in the early stages and therefore it becomes a childhood cataract. Though there are various reasons for developing a cataract, it is essential to know the exact cause and treat them when they are young. Treating the root cause is as important or sometimes more important than treating the cataract itself. As I said, we next move on to the symptoms of cataract in children. Cataract can be present in either one eye or both eyes. It is important to notice signs like cloudy patches in the lens, pupils appearing white when a flashlight falls on it, cloudy and hazy vision, seeing halos around the light, etc. Not just this, cataract can cause, most importantly, misaligned eyes or what we call commonly as squint. Wobbling of eyes or nystagmus or uncontrollable eye movements again can happen in some situations when the cataract is too dense. Now, the prevention of cataract in children. This is a pretty challenging task. When the cataract is inherited, it is not possible to prevent formation of cataract. So if cataract runs in your family, then make sure during pregnancy you avoid any kind of infections and also take care of the vaccinations at regular intervals. Taking genetic counseling can help as it will help the couples to decide with the inherited conditions. Coming to the treatment of cataracts in children. Children's cataracts do not always affect vision. If the cataract is small and does not affect vision, it may not require any intervention or surgery and it need not be removed at all. But in case of congenital cataract, if it is dense, it should be removed as soon as possible without any delay within the first few weeks after childbirth. This is very, very critical to avoid a condition which we commonly call it as amblyopia or lazy eye in colloquial terms. Amblyopia can cause irreversible decrease in the quality of vision and the quantity of vision in the childhood, which can carry over even into adulthood. Many a times, though we can put efforts to reverse amblyopia, but then the challenges will be increased if we keep delaying the surgery for cataract. In case of cataract surgery, the surgeon will remove the lens through a small incision. Then it is up to the eye surgeon to choose an alternative of the lens removed. The options include an artificial lens, contacts, or eyeglasses. Eyeglasses are sometimes prescribed even after the surgery. Treating your child's eye is important as it will help save their vision. Your child must take medications and precautions after the surgery. Make sure you fix a regular appointment with your ophthalmologist to keep a check on his or her recovery. The only way to ensure that the cataract does not do its damage on the eye is to have an ophthalmologist consultation once at birth and again at 6 months of age. To help you deal with your child's eye problems, Nelivigi Eye Hospital offers the latest technology and has an expertise of pediatric eye surgeons. It is considered as one of the leading eye hospitals in Bangalore and provides the world's leading laser automated technology for cataract surgery. Don't hesitate to schedule an eye exam if you feel that you might need assistance on child cataract. I hope you found this podcast particularly useful. We look forward to having you join us again next week for another existing episode of Let There Be Vision podcast. Thank you so much for listening, and it's me, Dr. Sirish Nelivigi, signing off.